Uganda is a little unique. We have very hospitable people. We have been receiving these refugees since 1959. The host community are very generous to the extent that they give away their land, the land they own, the community land, to us refugees.
Thank you.
Yes. The services that we offer here, we have maternity services. We also have nutrition services. We have HIV clinic. We also have outreaches that are done on particular days. People go out into the community to reach out to the people who cannot come to the health center.
Cambia has come at the right time to help us speed our activities. You know, we are overwhelmed by the number of clients that comes into the health facilities.
The patients are actually responsible for bringing their own notes back into the clinic. And it becomes difficult because of the situation where they're not able to bring them. The records aren't very durable, so a bad rainstorm or they get dropped in a puddle and then they're no use anymore. There's just almost no end to the paperwork that can be filled out. And it takes a lot of time and effort to do that.
Everything is paper-based. You move from place to place in a clinic. You can imagine getting an initial assessment and then having to go to the lab and then go to the pharmacy. At every place you have new paperwork that you have to fill out. So if there's a way that we can streamline that, it would actually reduce costs and help improve efficiency.
Well, we've come a long ways since the beginning of the week. We're at the point now. Yesterday we spent all day working, lined up essentially all the stories describing what the application's going to do. We have people in Portland who are working on things. Field visits are critical to what we're doing. It's critical to understand how they want to interact with it, what kind of information they need, what's more natural for them. We want to get feedback on how we're not quite sure how that UI interaction should go. So try and capture that in the app, show it to somebody, get that feedback so we can quickly make a change to it.
We've been working on replacing the tally sheets that they're having to manually mark for each visit, and this is just going to make it a lot simpler. We went and saw a couple doctors today, and they loved it. They were really happy with the layout.
It will give us opportunity to show you that MTI as a partner is not sitting back. It's also bringing something on the table. They were very open. They're waiting to see what is happening, and they're even ready to incorporate whatever we are going to do into their system.
This is a combination of the United Nations, the government of Uganda, Medical Teams International, and Cambia Health Solutions, all working together to make this a reality. Without that partnership, without that four-way partnership, this would never be possible.